Well, hello viewers, welcome to News and Trends, and you're watching the Daily News Bulletin with me, KV Nurmi. In the next 10 minutes, we will try to bring you all the latest news and updates from the coronavirus pandemic from across the world, the country, the region, and from the state as well. So stay tuned. But first, let's take a look at the headlines. Prime Minister Modi indicated that the coronavirus lockdown would continue in the parts of the country worst affected by the infection. Second consignment for biosafety laboratories along with technicians reach Nagaland. And COVID-19 death toll rises to 872 in the country, and cases climb to 27,892, says the Health Ministry. Now the details. Prime Minister Narendra Modi said today our economy is good and indicated at a video meeting with chief ministers that the coronavirus lockdown would continue in the parts of the country worst affected by the infection. There is no need to worry on the economy front. Our economy is good, Prime Minister reportedly told 9 chief ministers at a video meeting. 5 of 9 chief ministers at the meeting said that the lockdown should end, while the rest were in favor of extending it for the sake of controlling the spread of COVID-19. Sources said the Prime Minister has asked all states to prepare the plan on exiting the lockdown by demarcating districts as red, green and orange based on the level of infection. Economic activities are likely to reopen in green and orange zones, says sources. But any commercial activity will be allowed to restart only with social distancing rules and masks. The chief ministers of Bihar, Odisha, Gujarat, Haryana, Uttarakhand and Himachal Pradesh and the Union Territory of Puducherry spoke. From the northeast, the chief ministers of Meghalaya and Mizoram expressed their views. Kerala Chief Minister Pinaravi Vijayan skipped the meeting and sent the chief secretary to represent the state. A final decision will be taken after May 3 when the lockdown is due to end. The states that are comparatively less affected by the COVID-19 infection could reopen, especially in districts. Sources said the states asked for a financial package from the center. Restrictions on public transport are likely to continue, schools and colleges are likely to stay shut, and the ban on religious meetings and congregations will also continue. Meanwhile, Meghalaya wants the lockdown in the state to continue beyond May 3 to stem the spread of COVID-19, Chief Minister Conrad Sangma said on Monday after a teleconference with the Prime Minister Narendra Modi. The Chief Minister, however, said some relaxations would be introduced in green zones and non-COVID-19 affected districts after the nationwide shutdown has been lifted. At the video conference called by Honorable Prime Minister Narendra Modi ji and Honorable Home Minister Amit Shah ji, we have mooted to continue with the lockdown in Meghalaya, Sangma tweeted after the video conference. Meghalaya has so far reported 12 COVID-19 positive cases, of which 11 are active and 1 person has died. 2 districts have been classified as red zones. Meanwhile, Nagaland Chief Minister Nefirio also tweeted on his participation at the video conference with the Prime Minister today. The second consignment for biosafety laboratories BSL along with technicians reached Nagaland by Indian Air Force C-17 Globemaster. The consignment for both BSL-3 at NHAK Kohima and BSL-2 at Christian Institute of Health Services and Research Referral Hospital was received by district medical officials and CIHSR authorities. Nagaland Chief Minister Nefirio tweeted saying, with this, work for setting up the second biosafety laboratory at Referral Hospital, Dimapur will also start immediately. Health Minister Espangi Phom in a tweet also informed that the equipment for BSL-2 to be set up at Referral Hospital, Dimapur, along with some additional instruments for BSL-3 reached Nagaland. We ensure the latest achievement will immensely benefit our people in the long run, he tweeted. The death toll due to COVID-19 rose to 872 and the number of cases climbed to 27,892 in the country on Monday, according to the Union Health Ministry. The number of active COVID cases stood at 20,835, while 6,184 people were cured and discharged. and one patient had migrated, the ministry said. Of the 872 deaths, Maharashtra tops the tally with 342 fatalities, followed by Gujarat at 151, Madhya Pradesh at 101, Delhi at 54, Rajasthan at 33, and Andhra Pradesh at 31. In the northeast, Meghalaya and Assam have reported one fatality each. According to the ministry's data updated in the morning, the highest number of confirmed cases in the country are from Maharashtra at 8,068, followed by Gujarat at 3,301, Delhi at 2,918, Rajasthan at 2,185, Madhya Pradesh at 2,096, and Tamil Nadu at 1,885. Assam has registered 36 infections so far. Meghalaya has reported 12 cases. Manipur and Tripura have 2 cases each, while Mizoram and Arunachal Pradesh have reported a case each. Total cases around the world rose to 2.86 million and deaths mounted past the 2 lakh mark, doubling since April 10 according to an AFP tally. Europe, the hardest hit region, has recorded 1,22,171 coronavirus deaths. The United States has seen the highest number of deaths for a single country with 53,070 fatalities, followed by Italy at 26,384, Spain at 22,902, France at 22,614, and the United Kingdom at 20,319. New York, which has ground to a halt to stop the coronavirus pandemic, may start reopening manufacturing and construction after May 15, Governor Andrew Cuomo said yesterday. With schools shut across Nagaland owing to the lockdown, the Department of School Education has encouraged schools to conduct online classes. Principal Director of School Education, Shanawaz C, has informed that the Education Department has given an advisory to conduct online classes for the students, as some private schools in Dimapur and Kohima districts have come out to conduct online digital learning classes.
From our department, we are given directions to all the schools, like as far as possible, you try to implement these online classes. Not online classes especially, because government schools you cannot expect an online classes, because we are still running for these virtual classrooms with the projector and all, but that's not practical here. So let us be very practical. What we exactly told them was that if it's not possible to have a live interaction from the teachers to students, but at least just teachers can have a personal interaction with the parents. So I heard one Little Flower School is doing it, the online live classes, and Kohima I have asked for some schools details from this all Nagaland, like private school association. So yeah, I'm yet to get the details of Kohima, but whoever is doing this, it's a good thing. We encourage them to do it.
The general public of Mohokchung district are informed that a dedicated helpline number at the control room for COVID-19 at district headquarters has been set up in any unfortunate event relating to COVID-19. The helpline number is 0369 222 6231, landline, and 8131 836575 WhatsApp. In view of the lockdown due to COVID-19, the Director of Technical Education has informed all the intending candidates that the last date of form submission for both Nagaland State Entrance Examination NSEE 2020 and Diploma Entrance Examination DEE 2020 for the session 2020-21 has been extended till further order. The Kohima Village Council has issued no objection for burial of COVID-19 victims, stating that the decision was taken in an emergency meeting held at KVC Panchayat Hall yesterday. According to DIPR, the purpose of the meeting was to clarify the controversial issue of burial of COVID-19 victims. The meeting was addressed by Advisor Urban Development and Municipal Affairs Dr. Nikisili Niki Kere, MLA Krehu Lizitsu, Deputy Commissioner Kohima Gregory Tejawale, Principal Director Health and Family Welfare Dr. Vizile Sokre and his team of senior doctors. In the meeting, a thorough discussion was held regarding the disposal and burial of COVID-19 patients in the event of an unfortunate death. The dilemma as to whether the dead body should be brought home to the village for burial after being properly put in plastic body bags, disinfecting the coffin, and after taking all necessary safety precautions was deliberated. To this end, the Health and Family Welfare univocally made it clear that there would be no additional risk of infection after a dead body is properly attended and treated as per protocol. It was thus unanimously agreed in principle that the dignity of the dead, the religious traditions, and their families should be respected and protected throughout, and that after observing all the standard precautions, the mortal remains of the COVID-19 patient would be allowed for burial in the village, cemetery, burial ground of the family, or church without any discrimination, taking utmost care. The Kohima Village Council further expressed their appreciation to the Health and Family Welfare Department, the district administration, and all frontline workers for their tireless efforts as they continue to fight the coronavirus pandemic in the state. Let's now take you to Kohima, where a briefing is being made on the daily status of COVID-19 in the state.
Good evening. Till date, a total of 629 samples have been sent for testing from the state. The results of 613 samples have been received and all are negative. The results for 16 samples are awaited. Today, a total of 1,090 persons have been screened and a total of 31 persons are under facility quarantine. Today, the Honorable Prime Minister of India held a meeting with all the Honorable Chief Ministers of the states through video conferencing. The Honorable Prime Minister appreciated the joint efforts of the Chief Ministers on various fronts, particularly in enforcing the lockdown, which has helped in slowing the spread of novel coronavirus in the country. He, however, forewarned that the danger of the virus is far from over and urged for constant vigil. There have been some apprehensions expressed in certain quarters regarding burial of bodies of persons in the unfortunate event of one's death due to COVID-19. In this regard, I would like to inform that the Health Department has prepared a standard operating procedure or SOP, which is to be followed by all the hospitals and all concerned for preparation of any dead body for safely burying or cremating it, as the case may be, should anybody unfortunately dies due to COVID-19. All the hospitals and the district task forces have been made aware about the details of the SOP and they are suitably prepared for the same.
That brings us to the end of this bulletin. Do subscribe to us on the YouTube channel and also follow us on Twitter. Do stay tuned as we try to bring in lots more of news and updates through this medium. Meanwhile, we once again request you to kindly take cognizance of all the directives issued by the government from time to time in order to contain the COVID-19 pandemic. Meanwhile, stay home and stay safe. From all of us here, it's bye for now and thanks for watching.